My name is Rob Havasy. I'm from the Center for Connected Health. I thank you all again for being here at our symposium this year. We are trying something new, so for those of you who have never seen us do this before, or think you've never seen us do this before, it's because we never have. So I'm going to ask for a little bit of your patience. In a crowded room where we have actual demos and devices, you'll see lots of things that move around here today. This is going to be a new adventure for us. You're going to play a bit of visual ping pong today, because we're going to have two podiums going at once. We will be presenting on one while we're setting up for the other, so we can wrap this up and get everyone out of here in an hour. So, with that, I would like to introduce our moderator today and extend my thanks to Jonathan Linkous, the CEO of the American Telemedicine Association, for helping us make what I hope is going to be kick off what is going to be a great event for us for the next few years.
Thanks, Bob. Appreciate it. And so the ground rules, you folks, if you don't know, the presenters have 4.5 minutes to present. There's a timer down here with a yellow and a red light, and they know if it hits the red light, they're gone, and I'll make sure that they know that. We've done this at ATA for a few years, and it's a lot of fun. I think you guys are going to really enjoy this. And so I think what we ought to do is go ahead and start off right now. And we're going to have, as Bob said, we're going to have people go bounce back and forth from podium to podium. The first speaker is Kurt Schaum. Kurt's Vice President and Product Specialist with Health Advocate, which is a long history in the healthcare industry. He's had leadership positions in a number of organizations. And Kurt, why don't you go ahead and take it away?
Thank you. How do I get the... Oh, there we go. My name's Kurt Schaum. I'm with Health Advocate. We're one of the nation's leading health advocacy organizations. We were founded 10 years ago. We have about 7,500 employer groups that we work with, over 21 million members. And we were founded on the premise of helping people navigate the healthcare system. So it was founded as a reactive model. And about 18 months ago, we came up with a program called Benefits Gateway Dashboards. And the idea behind that is it's for self-funded employers, and it leverages member engagement to drive compliance with health initiatives. So as more and more organizations are looking to find ways of getting members to actually do the right things with their benefits, one of the things that was happening is there seemed to be a disconnect with the member. So the idea was to try to get a member involvement in the engagement and use the Benefits Gateway and the claims and utilization information that we get to identify gaps in care. The program, Benefits Gateway Dashboards, has 4 dashboards. There is one advocate screen that our folks use when they answer the phone, and they coach the employee. There's two client screens that are designed so that an organization can see what their claims and utilization looks like in aggregate on one dashboard, and then another dashboard that tracks the results of the coaching opportunities that we have with their employees. The 4th dashboard is this member screen, which I have up now. And the idea behind the member screen is for the member to be able to look at their own claims and utilization information and how their benefits have been used throughout the year. It identifies where their gaps in care are and where there's opportunities for them to make savings decisions. So if I can just go through this very briefly. On the left-hand side, as you see, there is general information. But one of the nice things about the program is that as you go through this, if I'm looking at the health resources, if I want to find out what's going on, if I'm the member and I want to find out how my programs are set up through Caremark, I can go to the Caremark section there, and I can actually click on Caremark, and it will bring up the Caremark website. So that if Caremark allows for single sign-on, actually, what we can do is actually direct them to the web page that is available for their organization. And then the other things that we have on the left-hand side look at what are the top 3 doctors that the employee is used in the previous year, as well as urgent care centers. And one of the neat things about this is, as organizations are trying to get people to use urgent care centers more and more rather than running to the emergency room, a lot of people aren't aware of where the urgent care centers are near their home. We list the 2 closest urgent care centers to a person's home. If they click on the name of the urgent care center, they actually get a Google map that takes them from their home to the urgent care center. so that it removes that barrier to care that people often have. They don't know where to go, don't know what to do. What did I just do? Okay. If you'll bear with me here. This would be how a member gets to their personal dashboard. I wasn't planning on demoing this, but this is great. Okay. So when you get to this landing page, what you'll do is you would scroll over to the various solutions that we have available for this member, and we went to the health dashboard, and it will pull up the health information dashboard. And then to view the dashboard, you just click on this, and it pulls it right up. Hopefully. Okay, so we talked about the things on the left-hand side. On the right-hand side, we look at the top 3 prescriptions that the person is taking, if there's a generic available, and then what would be the savings opportunity there. These personal profile trackers allows the member to actually input information on their own file. And then down at the bottom, we actually have medical tips where if a person clicks on that, they would be able to read about their disease state. And finally, the other issues that we have are the spotlights. And the spotlights are individually selected, and basically it has scripting that would tell the person, this is your #1 challenge, here's what the challenge has to do with, and this is what you need to overcome that challenge. Thank you.
All right, thank you very much, Kurt. Appreciate it. Great presentation, good product. Little technical difficulties, but you handled it well. Thank you very much.
Keith, hi, are you here? I saw you this morning. Okay, come on up.
Now, if we can, as we move forward, if we can have the next presenter for over here get ready and right before your time, maybe get up so we have not much of a delay in transition, because I don't have that many jokes to tell the audience. But it's a great number of folks that are here and a great array of products. I think we're going to get ready in just a second. Let's say we have. We have 12 folks presenting, is that right?
Yes.
12 companies. And it really represents just the tip of the iceberg of what we're seeing in telemedicine right now. It's a huge, I say it's a kind of a mile-wide field right now. And I think looking at it, and I looked up all the products last night and all the companies, and it's amazing the variety of things we have going on. Are you ready, Keith? Yeah. All right, take it away.
Just wait for the slides to pull up in just a second. My name is Keith High. I'm an engineer at a company called Athena GTX. We do small wireless medical devices, and I'm the program manager for a product called MiniMedic, which I'm here to demo today, which does not seem to be pulling up at the moment, but I got them in my hand, so I guess we could start there.
There you go.
Yeah, yeah, so these are the devices. I know I was going to try to do a demo. Is that it? Okay, so yeah, this is the front page showing the devices. I was going to do a demo, but as you guys can see, especially those of you way in the back, it's very small. This is a patient-worn device that goes on the patient's forehead, as you can see in the top left corner of the screen, and a handheld reader that the medic would carry around. Now this is kind of, the handheld unit is kind of like a collector for all the wireless devices. You could do 10 patients at once, and it's all Zigbee linked in, so very similar protocol to Wi-Fi, and you can do multiple patients at once. Now, this was originally developed as a part of a DoD contract for special ops, and you can kind of see the camo theme, and there's some military-specific features that we integrated into the device. But this is really meant to go into the medic's backpack and out into the field to the point of care. We're getting a lot of interest, some traction with natural disasters overseas. There's a lot of third world countries with earthquakes, tsunamis, hurricanes, things like that have a very limited infrastructure and, frankly, poor hospital systems. Red Cross brings in a lot of people to help, and there's no roads. It's very hard to get to those remote locations. So as I said, the way we sell these devices is you'll get one reader, so one unit for the medic to carry, and enough monitors to do 5 patients. We have about a 100-meter range between the two, so you can be fairly spread out, and they run on just standard AAA batteries. We do this because it's very hard, especially in the military, to find a reliable outlet to plug into on a nightly basis. Or if you run out during the day, you're not just like completely, sorry, tone this down, but yeah, you're not in trouble, so you can hot swap the batteries. So the monitor itself is about the size of your credit card if you look at it from the top. It's 3.2 ounces with the batteries in it. A lot of military people carry like 80 pounds of gear as it is. So you add an extra pound, that's a lot, especially when you got to hike 20 miles. So everything's very lightweight, very portable. And with the monitor itself, we do forehead temp. It's more like a fever monitor. We don't correlate to core at all. Pulse ox, so saturation, pulse rate. Also, there's ECG leads that plug in the connector on the side for heart rate. And we do, with ECG and SpO2, we do a pulse wave transit time calculation, which is kind of an emerging indice for trauma, which correlates the time gap between the electrical signal from the heart and when the pulse wave, so the blood pulse, actually reaches a distal location. You can correlate that to changes in blood pressure, not an actual like 120/80 measurement. So we do trend data on the device itself. You can view 3.5 hours of trended data for every patient that you're linked into. And we also have a proprietary summary alarm, so it's something that we developed in-house. And really what that is, it's called Murphy factor, and it's just to pool all the data that you have, things that we monitor ourselves. You can also manually input data too. And we just pool it all together to give you one numerical output, just so if you have 10 patients, you're not trying to scroll through tons of data, see what's going on. It's just a way to look at one number and be like, as a comparative measure, this guy's better than the next one. And our little disclaimer is that we don't use this to diagnose patients. We don't do this to predict the outcome of patients, just a way for everyone to, if you have to have one helicopter landing, you have to medevac someone, you know which one is in worse shape. So we can also manually input data as well. As I mentioned, MOI, drugs, MOI's mechanism of injury, so you can, if it's like a blast wound or a gunshot wound, you can indicate what it is and where. If you have ways to actually get that 120/80 measurement, you can input that as well, along with end tidal, CO2, respiratory rate, pulse integrity, pulse quality, which is that radial pulse feel. And if you're using GCS, you can do that as well. So the display unit, and as you can see here, very small and lightweight as well. And there's just a number of options. I just kind of scroll through the pages here so you can see different icons and things like that. So with that, a lot of other stuff we do and a lot of other information, you can go to the website or that's my email direct. So if you guys have any questions, please track me down. I'll be around. So
Thank you, Keith.
Yep.
Appreciate it.
Thanks.
We're off to a great start. A couple of countries. It's interesting to see the mix of the products, but it's kind of an explosion of online care and new devices, particularly focused on chronic care. And speaking of that, our next speaker is Jason Goldberg, who is with Ideal Life. And why don't you kick it away?
Good morning. Thanks for having me this morning. I don't know if I did that. Make sure everyone's awake, I guess. We were supposed to have a overhead here so everyone can see the live demo. Many of you know us for delivering more consumer-facing health technologies, leading health technologies around chronic conditions. And for us, it's always been about ease of implementation, ease of use, not only on the part of the patient or the health consumer, but really in large part as far as adopting technologies for long-term use, not just episodic 30, 60, 90-day interventions or care, really around long-term sustainable chronic condition management and bringing for the first time scale to what many of us are talking about here today at this conference. in the upcoming couple days. So today what I was hoping to show you, and again, I apologize for not having an overhead here, and the coverage is a little spotty here as well. I'll do my best to do the demo for all of you to walk you through it, because you probably won't be able to see my devices. So we put a PowerPoint slide for you at least to see things, and I encourage you to come up to me maybe after the session this morning, maybe in the hall, and I'd be more than happy to show you a live demo in person. So for us, what I'm hoping to show you today is a little bit about patient engagement and really the power and magic of delivering actionable data to the point of care. And the point of care truly is around the mobile patient, and actionable data points that can trigger content that's very personalized to the individual user, not just sending out one-way information to Never Never Land and maybe having interactions happen on the back end. We've been delivering successful programs as far as remote patient monitoring for years now. And again, continuing on the trend to deliver tools to further empower patients is really what this is all about. And to give you a simple example, all of our products wirelessly communicate through an available gateway as appropriate to the use case of the patient or health consumer. Information is remotely communicated, and depending on the implementation of a program, might be a long-term health management program where physicians receive trended data at the patient visit, or might be more of a surveillance model of care where home care or case managers receive information real-time after hours and can intervene a phone call or call the patient in to prevent a hospitalization. As we continue the trend and information becomes more accessible to patients, we can empower them with the right technologies no matter where they are. All of our wireless products, ID Life products, can also communicate wirelessly through an available cell phone. So here for you this morning, one example I have my cell phone. It might be in my pocket. Again, I encourage you to come up to me after. You'll see we have a simple application that runs behind the scenes on the cell phone. Again, for us, it was always about ease of use. I can have this in my pocket. I might have a glucose meter with me at a restaurant, maybe before I have lunch, take a blood sugar reading. For this morning's presentation, I have my ID Life pulse oximeter on my finger. Simply put it on my finger. It takes a reading. The cell phone in my pocket, I have an app running here in the background. I don't have to touch the screen. I take a reading with my pulse oximeter. Automatically, the information is communicated wirelessly. So when I have my reading here, I pull my finger out of the pulse oximeter. If you hear that dinging, the reading is now being communicated through the cell phone. Some of you up here can see some information being transmitted on the cell phone. And I don't have to push a button or to do anything, plug anything into the device. It happens automatically and seamlessly. Now, the magic, again, is around point of care. I might be anywhere, in the home. I might be on the go in the office. I actually just received a text message on my phone, and what I'd love to show you here is my notification. So again, the magic at point of care, no matter where I am, based on that specific reading, if there was an issue with that reading, or maybe even based on my goals and settings and thresholds, I received a notification on my device of a text message. So I'm going here, I click on the link, and again, the coverage isn't that great here. I have a video that I can play live here that's very personalized to me, and it'll load on here. It might take a few minutes because of the coverage. A video now playing on my cell phone, again, at point of care, that's relevant and very personalized to me. So the magic of delivering remotely wireless information, automatic triggers that come down no matter where I am, very personalized to me, the magic of powerful engagement tools. So right on the button.
There you
Thanks,
go.
Todd.
Thank you very much, Jason.
Thank you.
Appreciate it. Great job. So we're moving along. Next we have, is this William Cobb? Is that right?
Yes, it is.
Aha, because I had down your wife was going to be here, but I guess you got the better role. William is the general manager of Stratus Video, and we'll be up in just a moment as soon as we take care of a couple of technical details. And you're coming up ready for next? Great. Are we ready?
Yeah, we're ready.
Perfect timing.
Perfect time. Okay, I'm not going to do a product demo. I only got one slide. I do it the old way. I do it with index cards and I talk to you. What are we? We're Stratus Video. What do we have? I have the video waiting room. In other words, your patients, your doctors, your staff can all be connected to you through video and they can go live. It's all about connections. That's what you're trying to do. You're trying to connect with your patients, you're trying to connect with your staff, you're trying to connect with other doctors. We can make that happen. We're a cloud-based infrastructure. The video infrastructure is all in the cloud. In the back office, the back end of it is in the cloud also. You don't need to buy new hardware or anything like that. You just put a client on your workstation. The patient has a client. They put it on a device. You can communicate. That allows you to put your staff in queues. Now you can take a call and it can get distributed to your staff. It can get distributed to a special set of doctors. It all depends on how you want to set it up. We can enable you to distribute calls. You can have a staff of 3 nurses. It's Monday morning. You've got 12 mothers calling in. They've got sick children. Nurse takes the call, screens it, figures out what the issue is, makes a determination where it needs to go. Does it need to go to this doctor? Does it need to go to that doctor? They can transfer the call. All done live. It's all live video. The other important thing is we have the capability, if you need language services, either spoken languages or American Sign Language, we can bring that into the call so interpretation can happen live between the patient, the doctor, and the interpreter all on the same call. Okay, can the system scale? The system is built to go from small to large. It can handle HMOs. And you're going, that's great, William. How the heck do you do that? Well, let me give you the quick background. We've been spending the last 5 years building, perfecting, adding capability to this. And right now, today, Stratus Video, the network, takes 40,000 on-demand video calls a day. And how do we do that? We do that because we're one of the premier providers of video relay services for the deaf. Well, one thing about the deaf is they don't have a choice. They must do video to communicate because they have to see the interpreter has to see them for them to make a phone call. We spent the last 5 years perfecting that. We distribute calls to 25 different locations. And now we're bringing this to the hearing world, to the other side, to allow it for you people to use it for whatever you need to use it for. It doesn't get pigeonholed. You choose a specialty, you determine how you want to add video to it, how do you want to distribute your video, how do you want to have resources available to handle it. We have the system that can allow you to do that, and you can customize it. So, quick overview. Here's the main points. It's a video waiting room. It's cloud-based. You don't need any other hardware. And by the way, if you have hardware, if you have Polycom systems or systems from Tamberg, Cisco, or systems from LifeSize, we interoperate with it. We do that today. So if you're trying to get to a doctor and he's on a Tamberg system, we can connect you. We do that thousands of times a day already. No new hardware. We connect you to resources. You determine what resources you want to take the call. The doctor can be there. The doctor doesn't have to be in queue. The doctor is reachable by a phone number. And we can provide language services to meet your patient's need and your needs for translation services, either spoken language or ASL. That's it.
Thank you, sir. Appreciate it. On behalf of Stratus Video, nice presentation. If we're moving along, and I see we're ready to go already, so that's great. Laura Mitchell is Vice President of Marketing at GrandCare Systems, involved, I believe, in elder care. So, pick right away.
Okay, excellent. Well, good morning. My name is Laura Mitchell, and like Jonathan said, I'm the VP of Marketing for GrandCare Systems. We're located in the heart of Packer Country, so it's wonderful to be here today. One cannot seriously talk about the idea of healthcare reform or cost reduction without talking about aging, given the large portion of healthcare costs that are incurred in the later stages of life. Healthcare already consumes a distressing percentage of GNP, and with the boomers entering the chronic condition years, the financial strain on our society is certain to become more acute, if not critical. Our major problem, as a society, we buy pounds and pounds of cure. GrandCare is passionately driven to ultimately provide a source of prevention, the ounces of prevention. Indeed, as our founder, Charlie Hillman, is fond of telling anyone who will listen, if the boomers do not redefine aging, if they do not age responsibly, if they do not insist on the tools and infrastructure to age in place and heal in place, they will bankrupt their children and their grandchildren. And yet, we at GrandCare are very bullish about the future. We are convinced that given the right home-based technology tools, the people and their caregivers will embrace a new model of responsible wellness that will improve the lives and save our society billions of dollars. So let's take a look at the GrandCare system. Founded in 2005, the GrandCare system starts with a senior-friendly touchscreen computer, typically in the kitchen of the senior or maybe a not-so-senior who requires post-acute care at home. If not being accessed with this easy ATM-like interface, it looks like a digital picture frame showing a full range of personalized content, which is programmed remotely by the caregiver, either familial or professional. Meanwhile, 24/7, the system provides a wide variety of monitoring, which is accessible by caregivers across the internet. It maintains constant contact with a cloud-based enterprise solution to handle alerts, share data, and perform congregate analytics. The central system, called GC Manage, also performs the more mundane task of client monitoring, dashboard views, backups, centralized calendar, and software updates. With the patient firmly at the center, the system integrates 4 components: wellness, smart home, activity monitoring, and social connectivity. So let's start with wellness. The system accepts wireless physiological readings from a weight scale, blood pressure cuff, thermometer, glucometer, and pulse oximeter. We also have a home EKG device that's an alpha test that should be coming out in 2012. Each of these devices produces charts or graphs and supports simple rule sets to alert caregivers of abnormal readings. The data has been transferred to a number of proprietary electronic health records and the short-lived Google Health. We look forward to widespread health information exchanges to allow complete interoperability. The wellness component also includes medication compliance by interfacing with the RX Tender pill dispenser, or more simply by reminders and helpful medical information. Self-assessment is encouraged and typically generously given for overall wellness, mental state, or specific chronic condition. The patient is, of course, allowed and encouraged to view and better understand their physical and mental state. Add to this onboard videos to provide telehealth device instructions, health maintenance tips, medication compliance assistance, and we have moved from the measured life to the analyzed life, and now to the influenced life. The second component is smart home, controlling or monitoring lights, thermostats, and cooking appliances. The system can detect someone getting out of bed during the night and maybe light the way to the bathroom to mitigate a fall. Or perhaps if a stove has been left on too long, the system can cut power to the stove. The third component, activity monitoring. Supported devices include motion, temperature, door, bed, chair, caller ID, medication dispensers. Have the system text you if mom doesn't get up in the morning or if she gets up during the night and doesn't return within a specified time period. Make sure your dad's not a victim of a telephone scam. Have the neighbor called if grandpa leaves the house during the night. The fourth and final component, social connectivity. A large touchscreen with one-button Skype, email, reminders, calendar appointments, pictures, interactive games, music, YouTube videos, brain exercises, all with an age-appropriate interface. It's the glue that makes the system meaningful and useful. And all of this for less than 1 month of assisted living. GrandCare system epitomizes the notions, precepts, and goals of connected health. It is my honor to speak with my fellow warriors in the quest for responsible and affordable health care. So thank you very much.
Thank you, Laura. Laura Mitchell from GrandCare Systems, and we're moving from an internet-based application to a mobile app. I know you've been kind of working on technology, but I think you're right. You're ready, rather?
Well, I'm ready.
All right, Jonathan White is Vice President of Business Development of iTriage.
Thank you very much. I'm ready. My technology is not ready. So it was ready over there, but something is not good over here. So, but I am excited. We got some. Oh boy, there's a nice. I don't know why it's not showing here. Hang on. What we are is a mobile application, Android, iPhone, and why I'm particularly so excited to be here today, and this, I may go through this, I may not, is that with over 3 million downloads, we are the most distributed app out there that actually connects patients to medical care. Boy, you're seeing all kinds of stuff you don't need to see. Welcome to reloading. Oh, boy. But we're getting awfully close here. What we do is, we were founded by 2 ER docs, and I'll just let this go for a minute. Founded by 2 ER docs that understood that people really struggle in acute care environments centered around 2 primary questions. What's wrong with me, and what should I do about it? And so they knew that people really lacked the framework and the content. And so they built an app that has, it started in the front as a symptom checker. And the back is every single medical provider in the country, every ER, urgent care, retail clinic, physician. And what sits in the middle and makes iTriage completely unique is its decision support, a little bit of an ER doctor function sitting right inside the app. And we think of that as a symptom to provider pathway. And if I'm going to try to get the simulator up here, or not. Wow, you would, this is really. Don't ever restart your computer. Okay. Thank you. That's good. All right, so here we are. So, like I say, every point of care in the country in here, and I'm gonna put in Boston. I appreciate the offer of a phone, but it's a little hard to project that to the back. And so, yeah, might have to go to the back. So people might stop. Let's say I have something wrong with my chest, and I'm not really sure what's going on, but I feel like I have a slow heart rate. I can come here, and what come up are the common causes of that. So maybe I think I have an arrhythmia. I can get a quick description of that. I can cross-check my symptoms. I can look at the tests I might expect, treatment, all kinds of stuff. What this app is really about is finding the appropriate medical care. And so with that in mind, here's that decision support I was talking about, an ER doc kind of function. And now I understand for that, I need to go to an ED. And so, based on the proximity of my phone, and this is I'm pointing now to a demo server, not the live environment. But here I find that Mass General is at the closest hospital. I can find some content about the hospital, what kind of things they do well. And for about half a dozen at the moment hospitals out there, we can actually pre-register. And I'm going to go really quickly here because now, okay, I've survived this event. Now I know that I need to go find a cardiologist. And coming soon, we will actually be, in 2 weeks, we're going to launch the app that will have appointment setting capability. So I can learn about Dr. Leswing. I can find out what appointments she has available. I can tell what's a first visit. I'm a new patient. Perhaps I have insurance, hopefully. And I can do all these things, and then actually find. I know I want to go tomorrow because I'm having heart problems. I can actually find her availability. So we have done everything from take people from what's wrong with them to actually helping them figure out what it might be, what's the appropriate level of care, and now connecting them directly, either through registration, pre-registration at the ER, or appointment setting at the hospital. I made it. Those of you that saw stuff you shouldn't see, forget.
Did a great job, Jonathan. I offered him my cell phone because I happen to have the app loaded on it. Not that ATA endorses any one product, but it's a great job. And coming up next we have, is it Kian Sani? Yep. Great, and he's the Chief Executive Officer, CEO of Independa. Is that right?
That's perfect.
Take it away.
Thank you. Good morning, everyone. So we're an integrated telecare company, and everything that Laura said is absolutely true. So we're in the same market, and they've done a great job creating a market. I want to give you our view of our solution, and then I'm actually going to show you the application working. We have a web application that the caregiver uses, so you can use any browser from anywhere to contact our cloud services. At a minimum, you use only a telephone where the care recipient is. So you don't need these other services, but with this you can do medication reminders, calendar reminders, you could do activities of daily living support, as well as a lot of social engagement. You get a call, it's your grandson's birthday, press 1 to get connected. We also help you record life stories for that individual. So there's a lot of social engagement built in just to the simple telephone. For social engagement as a whole, we have a tablet-based system. It's a touch screen. So you get a reminder platform here that you see what's coming and going in your life. This is the care recipient now. You have access to the internet, to games and puzzles, photos, picture frame, videos that were sent. You actually see the data from your health biotelemetry. You can look at a planner, see your daily medications, see your weekly calendar events and so forth. And you can actually go into social and go to YouTube or Facebook or email, all single touch. So so if I were to go to my contacts here, I can press video and go there. So that's the second piece of the puzzle there. And the last but not least is health and safety. So we integrate activity and health sensors in the home along with biotelemetry, so a scale and pulse oximeter, glucometer, and blood pressure. And we give a holistic view of how things should be. And also this caregiver can manage multiple care recipients. So it's an enterprise solution, and you can have multiple locations, each with multiple care recipients. With that background, I'm actually jump into the dashboard view. So this is the app that the caregiver sees. So this is my fictitious mom, Rita, and if I can get the mouse working. So I go to medication reminders. I can add medications here, do the calendar reminders. All those go to the phone first if you don't have the tablet. If you do have the tablet, the reminders go there. If you don't respond, it goes to the phone. I want to take the time here to show you actually how rules are set. Very simple. You go in, you define what's important to you as a red alert. So in this case, I want to get an alert once, only for a single instance, not 2 or 3 times. And I want to get it by email, text, and phone. And if I don't actively respond and reply by one of these methods, then it gets escalated, in this case, to my brother. And he wants to just get a text and a phone call. And if he doesn't respond, it gets escalated, in this case, to Joe Neighbor. If somebody isn't there, you start adding contacts right there. So super user-friendly. Our system was actually designed, and the company was launched thanks to a lot of work by IDEO, the design firm where they defer their costs to help launch the company. So it's all about simplicity and ease of use, and that's how Red Alert is defined for the whole system. So I'm going to pick Joe again. Orange is similar, except there's no escalation. And if I can grab the side here, I'll show you. The last thing is a yellow alert, which simply is a report entry. Notice for orange, I can skip, let's say, from midnight to 8 a.m. if I don't want to get a call there. From there, and I'm skipping over all the other life stories and smart reminders, everything else in the interest of time. I did make some changes, so it warns me if I want to leave the page. I do. And I'm going to go to settings and thresholds. And you'll see how easy it is to actually set up your system. So we don't diagnose. We help you care when you can't be there. You could be a professional or family member. And as Laura mentioned, there's huge amounts of cost. This is the largest area in healthcare that people are paying out of their pocket, and it's only going to get worse. So not just in this country, globally, we have 600 million people today taking care of someone who's older and looking to stay independent. So here, home is too cold. Well, mom's in Fargo, and for furnace breaks down in January at midnight, she's not going to get out of bed. So I'm really concerned about that, and that's a red alert. Dad's in Orlando, and he gets dehydrated a couple times a year. Every summer gets sent to the ER because he doesn't realize it's getting hot. So at 85 degrees, I want to get an orange alert, and so forth. And we handle, I just went over, so we handle health and activity exactly the same way. So very easy to use, consumer-friendly, as well as enterprise-centric. Thank you.
Thank you, Ken.
Thanks.
Appreciate it. Ken with Independa. Great job. So we've talked about mobile applications. We've had some medical devices, talked about internet applications, and now we're moving to the robots. Peter Vickers, CEO of Vigo.
Thank you very much indeed. My name is Peter Vickers. I'm CEO of Vigo. Back in 2007, a couple of guys that came out of Picturetel and iRobot looked at the problem that actually presents us here. If you go into a video conferencing environment, you're in one location. You can't move around. And in fact, when somebody says it's a coffee break, the meeting takes place down at the coffee hall. And everything takes place there, but the remote player is sitting back in his room, not involved. So we looked at this problem and said, how do you deal with it? How do you create something very different? And we've created something very, very different. Come on over, my friend. Vigo allows us basically to go where I want to go, but not take the trip myself. It allows me to position myself in a different remote location, and it allows me to be there, but not be there, to be the virtual me. This is Vigo, my friend. He's an interesting little fellow. As you can see, we've put together all of the capabilities of wireless, video, networking, and connection. He can go anywhere, drive anywhere, and he's being driven by somebody remotely. In fact, Dr. Tom, where are you? You're possibly in some skyscraper up the top of the hall there. That's what he's allowed to do. What the application is that actually works this thing best, to show it off, is an easy one. We had a mum who saw this application, and her son had a little bit of a challenge with an immune deficiency syndrome. And she said, he can't go to school. He just can't go to school. That young man now goes to school because his mum ran a bake sale and actually bought Vigo. Why could she run a bake sale and buy Vigo? Because Vigo basically is a $6,000 device. It allows you to basically take a child who can't go to school on a Vigo, walk down the hallway with his friends, participate in the lunchroom, be involved. He's a charming fellow, this Vigo. He actually works in a lot of different applications. We've got an application right now where it's in a readmissions environment. And he's involved right there going home with a child so that when there's a problem with a wound, we don't bring the child back to the hospital. But my friend Vigo walks up and actually potentially looks at the wound, doesn't actually potentially, does look at the wound. Actually, hey, Uncle Tom, you going to take a photograph of this wound that I got on my shoulder? Takes a photograph, sends it back, and is involved.
Say cheese.
Oh, cheese. Vigo changes the way that you can do potentially customer care. We're involved in translation services where the robot or Vigo is available. I can walk up, push a button, it launches a call to the appropriate translator, involves that translator in the location without a problem. Vigo, a different way of doing customer care in the healthcare marketplace, and creates a completely changed environment. Thank you for listening to us about Vigo. Please come and share.
Thank you, Peter. Peter Vickers from Vigo. And we see Vigo leaving the stage. So we're moving, I'm not sure how you guys chose this, but I think I know. We're moving from Vigo to Zeo. Ben Rubin is the CTO and co-founder of the company. Take it away.
Thank you.
we are a sleep management company, and that means that we are creating products and services to help consumers manage their sleep. So first, a couple of reasons on why you care about this. Sleep is a huge important factor in chronic disease. Diabetes, heart disease, but here's the piece that most of the people in this room may not understand, but consumers get. No one cares about whether they're going to die, 20% more likely to die in 20 years. That is not a motivator of consumer behavior. This is what's a motivator of consumer behavior. You are 100% more alert after a 20 or 30-minute power nap if you do it right. You can actually win on the courts. You can have a major increase in sport performance using the power of sleep. And then the big one, we can help people look better naked. This is what drives consumer behavior. This is what drives billion-dollar industries in weight loss and exercise, and we're taking that into sleep because sleep can help you improve your performance, and it can help you live a longer and healthier life. So how are we doing that? We're helping you measure first and then manage. So we've created the first tool, which I'm about to show you, that measures your sleep quality and really enables you then to manage your sleep. So this is Zio, and I'll pop it out and put it on my head as well. It's a lightweight headband that actually measures your brain waves. That's sort of a little buzz of light sleep right there in the middle. It's the first device in the home that actually can get you deep sleep, which is restorative for your body. We can give you information about your REM sleep, which is restorative for your mind. And we actually just launched something new, which I'm going to show you right now. This is a mobile Zio. So this Zio has Bluetooth. It communicates directly with an iOS or an Android product. You can set an alarm and wake up at the optimal time. This is actually the original way that we built the product. We said there's a better way to wake up. Then you fall asleep, and I'll show you some of my sleep data. This is last night. This is a shitty night of sleep. So that's a 58. 58 is like failing at life for me. And I'll show you a better night soon, but why did I wake up for a solid hour in the middle of the night? We're launching a product in 5 days, and there's a lot of stress involved in that. Let me show you a better night. Here's a 111. So I got an hour and a half of deep sleep versus the 42 minutes you saw when I was stressed out. I got over 3 hours of REM versus the less than an hour and a half. So the changes that you make in your lifestyle, whether it be stress-related, whether it be your bedroom environment, this is what actually has an impact on your sleep quality. So great, you say, you've got a really cool measurement tool that helps you see all this cool stuff about your sleep. Why does that matter? It matters because what we then done is connected that to a service that helps you learn about your sleep quality and actually motivates you to improve your sleep. So Zio is in the sleep management business, not the sleep measurement business. We think of ourselves as the Weight Watchers of sleep and really creating that for consumers. So what does that actually look like? This is a pair of blue blockers. There's a guy out there who used this product, which is essentially a pair of glasses that blocks out blue light. Oop, I'm losing it. Blocks out blue light and creates, so your circadian rhythm is affected if you're out late at night and you're being exposed to light. That can screw with your timing. Put on blue lights, he reduced his time to sleep from 30 minutes, so it was taking him 30, 40 minutes to fall asleep, to 4 minutes. That's a huge difference, right? What we can do now on a mobile device is actually suggest to you, here's what you should try tonight, right? Here's a relaxation program, press this button, deliver it to you immediately. Oh, you're going to travel to Hong Kong. Here's a jet lag management program that'll take what would normally be a 12 or 14-day adaptation period, and by using the right combination of light and melatonin and caffeine, we can take that down to 3 or 4 days. So it's really about bringing for a consumer all the different pieces that they knew maybe in the back of their mind they should be doing about sleep and saying, here's what you do tonight. We're going to measure that so that we can see whether it made an impact on your life. And then you're going to make those changes and get those benefits like looking better in the mirror and having more energy and, for all of us in the room, drastically reduced healthcare costs because we're going to reduce chronic disease across the board. So I encourage everyone, I see we're here early in the morning, which I wouldn't have been angry if you decided to sleep in, but take sleep into account in your life, and Zio can help people manage that on a mass scale. Thank you.
Great job. Thanks, Ben. Ben Rubin with Zio Inc. Appreciate it. Blue lights help you sleep better. Next up is Mr. Is it Hamid?
Hamid.
Hamid Tabatabi?
Good enough.
Good enough. He's the president and CEO of lifeIMAGE.
Good morning, everybody. lifeIMAGE is a company that is hopefully making a difference in reducing the cost of healthcare by addressing some imaging needs. There are about 1 billion exams a year that happen in the United States alone, and about $20 billion a year of wasted exams because of repeated exams of various kinds. We use modern technology without requirement of software or hardware to create a network where a physician, a patient, a health system, and a payer can have access to imaging exams no matter where they were captured. So it allows you to avoid repeat exams. It allows you to care for the patient better. Trauma centers receive patient imaging information in advance of the patient arriving. And it allows you to reduce errors. Just last week, Boston Children's Hospital managed to avoid 3 brain surgeries by kids who were seen at remote facilities, and by 5-minute consults using our system, decided that the diagnosis in the original site was not appropriate. We have 50 of the largest health systems in the country so far signed up, and our approach is to go after the largest facilities where specialists live. There are about 32,000 doctors affiliated with our customers. 9,500 of them are subspecialists, what we call image intensivists, neurologists, oncologists, cardiologists, and the like. 26 million outpatient visits. As you would imagine, image exchange is mostly needed during either ER, trauma, or outpatient visits. And we have signed up some of the leading centers for particular specialties, whether it's neurology or neurosurgery, whether it's cardiology, pulmonology, and so forth. Effectively, what we've done is we have created a community in the cloud, whether a patient, a physician, a particular department can have an account on lifeIMAGE, receive information from anyone, exchange and collaborate with anyone, and we have finished the last mile in absorbing the data into the appropriate PHR, EMR, PAC systems, and the like. So we all can wait for various EMR vendors to figure out how they exchange information together. Hopefully that will happen while I'm live. But so far, we've managed to do that with lifeIMAGE without the need of software or hardware. It's just simply with the browser. As you could imagine, one of the more important constituents would be payers that are interested in avoiding the extra cost and avoiding the errors. And at some point, we think payers will subsidize and or pay for the network entirely. In the meantime, we have applications that encourage health systems to use the system. I'd like to show you some of that. Okay. See if I can get this to be, here we go. With Radiology Society of North America and NIH, we started a 2-year project about a year ago to sign up various patients to find out whether or not them having access to their own information actually makes a difference to their care, as well as avoid repeat exams. So now we have signed up 5 hospitals, starting with UCSF all the way to University of Maryland and University of Chicago, Mount Sinai in New York, and so forth, that are giving their patients an option that instead of walking out with a CD, they receive the imaging information in the cloud. First, when the patient logs in, they get a tutorial, and as you could imagine, they're needing a user interface that is very familiar with them, very similar to email. They can have access to diagnostic quality images. If there are any particular attachments, in this case, it makes sense for there to be an EKG. The EKG goes along with the imaging information, and if the patient decided to, they can share the information with anyone that they need to share it with. The recipient at the other end simply receives an email and a link, and they get connected to very much the same environment. Am I up?
You're up.
All right.
All right.
Thank you very much.
Hamid, thank you very much. Great job. Hamid from lifeIMAGE. Very nice. And we have coming up next, Nathan Pendleton, who is the Chief Growth Officer with GenerationOne.
Thank you. Good morning. How are you? Let's try that again. Good morning. How are you? All right. I'm with GenerationOne. We are a mobile engagement platform. I'll show you a few slides today, brief. I don't have any actual demos, but I want to share with you what we're doing. I put it in the presentation mode. Is that too early? Oh, sorry. All right, so we have a mobile engagement platform. We use mobile phones, cell phones, as well as IVR, but really we believe mobile is really the best way because you can catch somebody where they are, where they're standing, rather than, say, if they're not there at the time. So what we do is we have a platform. Thank you. So we have a platform. Our vision was a fully integrated mobile and wireless health platform, and platform's a key word there, to enable individuals to better manage their health and wellness. Now, what we're working with today are several different kinds of healthcare customers, and you'll hear me tell you today that our platform is flexible enough that we're working with payers, we're working with disease management companies, we're working with integrated hospital systems, we're also working with universities for clinical trial tracking. Our use cases and our platform are very flexible. Here's some example sample initiatives either we're working with already or we're designing use cases with our customers. The typical ones we hear in mobile are really the same across the industry right now in this fast-moving place. One, chronic condition management, obviously for the trying to bend the cost curve and using mobile in a productive way. Medication adherence, a classic example, whether part of a chronic condition regimen or just general medication adherence. Other ones getting a lot of traction in mHealth, mobile health today recently, readmission avoidance strategies, especially 60-day post-discharge. Also, post-op, centers of excellence, post-operative follow-up and engagement and monitoring, using mobile health strategies to engage patients and alert the right people at the right time, identifying changes in attitude or behavior or biometrics. And also patient transitions from hospital to home health. So how do we do this? We do this today in several different ways. One, we have a decision engine that sends the right reminder to the right patient at the right time of day, all with patient-specific triggers. We capture biometric, attitudinal, or behavior questions. It's a branching logic platform that can ask a follow-up question in the moment based on how you're trending or how you answered a specific question. In some cases, we actually provision a cell phone, and we can lock a cell phone down to only call customer-approved phone numbers. Or alternatively, because cell phones are so ubiquitous today, we can use a patient's existing cell phone. We can do this via a mobile web app. We can do this via SMS or text, or we can do also IVR, which is not cell phone dependent. And we can actually mix and match communication channels on the same cohort. The beauty is the way we do this today is not cell phone model dependent, it's not network dependent. So we're able to really have a wide net for what I would say ubiquitous across the ecosystem of what cell phone or landline do they have to capture the right person at the right time, to remind them to do the right thing for their self-care. All while providing, depending on the use case or care path, what is their condition or their situation. This is all two-way. We heard earlier, there are one-way strategies and two-way. Our model is inherently two-way, but you could do a one-way flu shot reminder, of course. These are some sample types of conditions and episodes and use cases we work with. And at the end of the day, the point is you get the right reminder on the phone. I'll go quickly here, but the second bullet, you get the right reminder on your phone or IVR on your ear or whatever. It's, again, phone agnostic. In real time, that information is transmitted to a back-end system that is hosted, and it will determine, is this a red light or green light? Should I notify somebody automated, or do I give this person a green light health tip for an attaboy, a good job, positive feedback? But in all cases, we can integrate the care circle. That's why we work with so many different kinds of healthcare verticals, because in some cases, it's just a health plan. In other cases, it's an integrated system where the doctor, the health plan, case manager, disease management nurse, and family member are all involved. We can tighten that care circle for all stakeholders and caregivers, or a limited use case depending on the deployment. This is all done in real time, if you will, and we have a clinician dashboard that's viewable by proxy and rule-based who can see what. And you can also provide access to the patient portal, see their journal, see their attitudinal, see their biometric changes in behavior and or situations. But the point is bringing all the information to the right caregiver at the right time. And this model, at the end of the day, increases engagement for increased self-care and compliance adherence, while providing actionable information to the right stakeholder. Thank you very much.
And thank you, Nathan. Nathan Pendleton with GenerationOne, Inc. And our final presenters, Debbie Theobald with Vecna Technologies. And why don't you go ahead and take it away? Thanks.
We're going to start off with a short video. QCBot is the world's most advanced yet cost-effective hospital logistics robot. This versatile platform provides a wide range of services, including medication delivery, linen, food, or package transport, waste disposal, clinical telepresence, bedside registration, security monitoring, wayfinding, and patient self-service. As an extension of hospital staff, QCBot can be used to transport and deliver medications and equipment securely throughout the healthcare facility. QCBot integrates with hospital information systems to ensure that the right medication reaches the right patient at the right time. Before delivery, items are placed in a motorized locking drawer that releases when the correct recipient verifies his or her identity using onboard biometric, RFID, or card imaging scanners. Using QCBot's video conferencing system, patients, staff, and doctors can talk about medications, treatment options, and other immediate concerns. This on-demand video conferencing function promotes timely, comfortable, and convenient communication. QCBot also comes prepared with a software suite for mobile patient self-service. Using QCBot's touchscreen, patients can check into a facility, verify their insurance information, and even ask for assistance in locating their appointments. QCBot can also deliver meals to patients throughout a healthcare facility. This automated bedside room service both fulfills a critical need and relieves staff of a time-consuming task. QCBot features the industry's most advanced mobility capabilities. In situations where most robots would be confused by an obstacle in its path, QCBot happily navigates around unexpected obstructions and may even intelligently find a new route to its destination. The robot may also be controlled remotely through any handheld mobile device, such as a smartphone or a tablet. The same app has a tracking feature, so hospital staff can determine the whereabouts of a robot within the facility at any time. With advanced mobility and security features, QCBot offers an exciting and efficient way to meet the challenges of hospital logistics and management in the 21st century. QCBot's versatility presents an exceptional solution for improving efficiency, accuracy, and patient and staff satisfaction in any healthcare environment. QCBot is one robot with many uses. So, 30% of the hospital's budget is spent on logistics. We aim to cut that in half. 195 average man-hours a week are spent on logistics within a hospital. This is something you can eliminate with the QCBot. I'd like to introduce you to Betty. Betty is a year old, and she is a part of our QCBot fleet.
Nice to meet you.
She talks. Did you hear that? And QCBot is quickly going into many different hospitals to be able to perform all types of services. As we said, QCBot is one robot, many uses. Not only can you have it as a telepresence and as medication delivery, but you can also do a lot more mundane tasks, such as taking out the garbage or delivering meals or collecting dirty linens or hazardous waste, of which tons are generated within the hospital environment. Vecna is the premier maker of patient self-service solutions here in the United States and internationally, and we've also incorporated that into our QCBot. As you see, it's able to carry significant loads as well. You can go ahead and move me around. So it can transport most things through a hospital. It's auto navigation with almost zero infrastructure, so you don't need to paint lines or retrofit your facility in any way. All you do is let it roam around, it learns where it is, and it's able to integrate into your hospital information systems, gather the work that needs to be done, optimize the fleet of robots, and carry out those tasks. If you'd like to learn more or meet Betty yourself, please feel free to come up and talk with us. Thank you very much.
Thanks a lot. Thanks a lot, Debbie, and thank you, Betty, as well. So I want to thank everybody for coming, and certainly thank all of the presenters who had a tremendous array of products. Let's give them all a great round of applause.